This is Dr. Arlen Meyers. I'm President and CEO of the Society of Physician Entrepreneurs. The next time you go to see your doctor and he or she writes you a prescription, ask them why they don't prescribe generic or over-the-counter drugs. Recent surveys indicate that most doctors agree that over-the-counter drugs or generics in most cases are as effective as brand name drugs, and yet when you monitor their behavior, they continue to prescribe more expensive brand name drugs. So why is this? In my opinion, there are four basic reasons. One is cognitive. In other words, they're not familiar with the literature, they have an incomplete understanding of the literature, or they don't simply believe that or think that substitutes are equally as effective as brand name drugs. Number two is a behavioral reason. Most doctors develop a habit of prescribing relatively few drugs for a handful of given conditions that they see most of the time, and like any habit, it's hard to break. Number three, there are attitudinal reasons. In other words, the doctor doesn't necessarily think that the studies apply to his or her patient, or they have strong feelings one way or another about using generics over-the-counter versus brand name drugs, or in rare but certainly real circumstances, they're being paid to prescribe certain drugs or are on speakers bureaus that influences their prescribing behavior. And finally, there are systemic reasons. In other words, even if the doctor wanted to prescribe a generic versus a brand name drug, they sometimes get pushback from patients who say, well, if you prescribe a brand name drug, then my insurance will pay for it. If I have to go over the counter or get something else, I'll have to pay for it. Or in some circumstances, the formulary where the doctor works does not allow generic substitutions for various and sundry reasons. So there's many reasons why doctors do not prescribe less expensive generic or over-the-counter drugs. Some of those reasons are in their control. Some of those reasons are not. This is Dr. Arlen Meyers. I'm President and CEO of the Society of Physician Entrepreneurs, and I look forward to your comments.